Hello everyone. So this video would serve as my very first lecture in preparation for the NCLEX, and this would be my first vlog of that lecture. And so I was going over the topics based on what I've collated these review materials. If I'm not mistaken, this came from Archer, or it could be Archer or UWorld. And the very first on top I saw it came to notice this neurology PDF, and I think it's the best system to study in my very first lecture because it dates back 20 in 2002 when I was in fourth year. So before the review proper uh, lecture, let me share with you a story. So I graduated BSN in 2007. Uh, I was first year freshman in 2003, and back in 2002, I was fourth year high school. When I was in fourth year, I was part of the book lovers club in our school, and as a member, I was one of those who was taking care of all the books in the library. And one of my tasks, of our tasks back then, was to clean the shelves and the books um, before we leave in the afternoon. And there was one shelf I will remember that I was looking at one of the books, and that book was underneath the shelf, and I saw the title of that book, and this was very same book that I've read. It's Genius with a Scalpel, a story about Harvey Cushing. So this is Harvey Cushing, the father of modern neurosurgery. Incidentally, he was born on April 8, 1869. I was also born April 8. And Harvey Cushing's that small book, that was the reason why I've taken up nursing in college. So in high school, I didn't know what to take up in college. And when I read that book, that inspired me to go to the medical field. Initially, I wanted to be a doctor, but of course, long story short, I did not became, I have not become a doctor. So, but I became a nurse, and Harvey Cushing inspired me to be in the medical field. Uh, William Osler, the Johns Hopkins University, and all of those. And in fact, in college, I created a group. We called ourselves the Circle of Doctors. Circle because it every Thursday we would meet and we would form a circle and discuss the pathophysiology or pharmacology, what have you, regarding and we were really treating ourselves as doctors, and really we were like minded individuals who were very interested in medicine. So I think I'd like to kick off my review with neurology, which is close to neurosurgery or um, about the or about the nervous system. So let me start the review proper then. Anna Fisher. So the way I would like to uh, approach my review is, if it's about lecture just like this, I'd like to ask myself, how would this be asked in NCLEX? What are the keywords or what topics would most likely be included in NCLEX? I'm very sure not all of these will be included, so I have to be selective at this point. I have to be selective and make sure that I am not just like skimming all through all the many pages or thousands of pages of lecture, but all of these would have an be related to how NCLEX could be asked, whether it be SATA or uh, fill in the blanks or multiple choice questions. Um, so that's how I would like to approach my review. Okay, so neurology, anatomy, and tissue. Uh, there's a central nervous system, so there are two systems. Um, I remember, even though it has been 15 years ago, most of my I think my stock knowledge is still there. So let me just brush through and refresh my memory. Okay, so central nervous system would be peripheral nervous system, composed this one composed of the brain, the spinal cord. Okay, brain, spinal cord, cranial nerves, spinal nerves. Okay, peripheral nerves contain sensory neurons, motor neurons. I don't think this would be asked in NCLEX, but it's good to know. Lobes of the brain. Occipital would be for vision, okay, at the back. Temporal, memory, okay. Understanding language. I think this would be in relation to possibly like um, multiple sclerosis or MS or any memory, or it could be stroke. Parietal, perception, math, spelling, logic, okay, at the middle. Frontal would be thinking, planning, organizing, okay. So these would be the lobes, and the cerebellum would be the balance. Language centers, the Broca's, expressive language, Wernicke's, receptive language. Okay, so the meninges, scalp, the skull, the dura mater, okay, and then arachnoid, and then subarachnoid, and the pia mater, which is the closest to the cortex. So from the skull, and then the dura, which is the hard part, arachnoid. This would be I think, if I remember it correctly, the there are fluids here. The fluids are passed through here, and then the pia mater closest to the cortex. The main three layers. So meninges. Yeah, so CSF, clear, colorless liquid found in your brain and spinal cord. So if there's a buildup, there could be an increased intracranial um, pressure, ICP. Okay, there you go. You see, I still remember, even if it's a very long time. The pressure inside the skull, normal 5 to 15. Okay. Monroe-Kelly hypothesis: the skull is a rigid container filled with blood, brain, and CSF. If one of those three increases, another must decrease. So it means it's because it's a fixed, uh, it's a fixed sphere. So if one of those three would increase in size, then the rest should be should decrease in size for them to fit all together, the three of them. Else it will explode. And the normal intracranial pressure would be 5 to 15. So this is something I need to remember. Causes of increased ICP. There could be two more. So, and bleeding, hydrocephalus, edema. So these are the common. Increased intracranial pressure, changes in LOC is level of consciousness. During my time, I remember all of these, but it's been a long time. Headache, there's a headache, seizures, change in vital signs, Cushing's triad, systolic, increase in systolic BP, decrease in pulse, altered respiratory pattern. So if there's an increase in systolic BP and decrease in pulse, altered respiratory pattern. So for now, I don't really remember um, the mechanism of action right now. I just have to memorize that if it's a Cushing's triad, there's an increase in systolic, so the upper portion of the BP, and there's a decrease in pulse. So there's really an issue. Supposedly, if this goes up, this should also go up. But since there's an increase and decrease in pulse, also vomiting, changes in speech. Um, in infants, there's a bulging of fontanelles. I think this, if this would be asked in NCLEX, this would be part of ASATA or select all that apply scenario. Uh, Bulging fontanelles, cranial suture, separation, increased head circumference. So I just need to make sense of all of these. High pitched cry. So I remember this. If there's a high pitched cry, normally there's an increased intracranial pressure. I remember this keyword. Decreased motor function, change in motor ability, posturing, the decerebrate, decorticate, flaccid. I remember decerebrate. Decerebrate is versus decorticate. Okay, so decorticate posturing is still an ominous sign of severe brain damage. Decerebrate posturing is usually indicative of more severe damage at the rubrospinal tract. Okay, let me. Okay, so it's decorticate. Decorticate. So decorticate. The mnemonic would be the court. hmm So the cerebrate, they're extended. The corticate, they're like the C, the cort, O, upper limb flexed and lower limb extended. Lesion above the midbrain, and this one is below the midbrain. Temperature regulation present in the corticate, uh, means the cerebrate, it's absent. Not better outcome. Better outcome. So I would say, I think the prognosis, there's arms to the core, it has a better outcome, and above the midbrain, below the midbrain. So below the midbrain would be the cortex, cerebellum, the pons area, medulla oblongata. So I think, uh, better prognosis for the corticate than the cerebrate. Okay, let's proceed. Prominent scalp veins. Okay, what we just have to remember is like select all that apply. I think this is something, this that's the only thing that this would be applicable in NCLEX. Nervous system, peripheral nervous system, automat. Okay, not something that I have to remember. Sympathetic, dilates. Okay. Parasympathetic, constricts. Okay, so the sympathetic is the fight or flight. So since it's an emergency, the pupils have to be dilated, less salivation because it's an emergency, relaxes bronchi, accelerates, so there's an emergency, so acceleration versus slows heartbeat, inhibits peristalsis and secretion. So in the GI, stimulates peristalsis. So this, parasympathetic is more on body preservation, and this one is more on emergency. So every energy has to be, will be devoted to the emergency situation. Mhm. Intracranial pressure. Okay, I'm sorry. hmm I don't. It's possible that this could be. They would be asked like what is the function of a particular nerve. So olfactory would for smell, optic, vision, oculomotor, pupil constriction, trochlear, downward movement of eyes, trigeminal, trigeminal neuralgia, so face, neck, jaw, okay, abducens, lateral movement of the eyes. This was the downward movement of the eyes, okay, trochlear. Facial would be facial movement. So for trigeminal, it's the face and the neck. Facial is the facial movement. Taste on anterior two-third of the tongue. So including the face and the anterior two-third of the tongue. Vestibulo-cochlear, So the vestibule would be the hearing and balance. Mhm. Glossopharyngeal, so pharynx would be swallowing. Okay, and 1/3 of the tongue. So facial is 2/3 of the tongue anterior, and the posterior would be glossopharyngeal. Vagal nerve, swallowing and speaking. Mhm. Spinal, spinal accessory, flexion and rotation of the head. Okay. Hypoglossal tongue movements. I remember during anatomy and physiology subject, we really had to memorize all of these. And this was the mnemonics. Uh, Different mnemonic at the time. hmm All right, synaptic transmission, the neurons. Okay, I don't think this would be asked in NCLEX. This one might be basilar skull fracture, battle sign, bruising over the mastoid process, raccoon eye, periorbital bruising, cerebrospinal rhinorrhea, test drainage for CSF, halo test, glucose. Never insert an NG tube in a client with a basilar skull fracture. Torn dura, nasogastric tube. Okay. Never insert a nasogastric tube in a client with a basilar skull fracture. I think it has something to do with vagus nerve or glossopharyngeal. So if there's a fracture in the basilar or the base of the skull, it's possible that the vagus nerve or these nerves would not work properly, and therefore there would be an increased risk of aspiration if nasogastric tube is inserted, since there's the nerve the nerves that support swallowing not properly working. Okay. Epidural hematoma, rupture to the middle meningeal artery, fast bleed, high pressure. So there is a hematoma, formation of the blood, oma. Heme is blood. Okay. Characteristics, patterns of symptoms, injury, loss of consciousness, recover, body compensates, and they seem okay. Body is unable to compensate anymore, and neuro changes begin. Agitation, restlessness, pupil change. So for epidural, talk and die phenomenon. Medical emergency. Treatment is to burr a hole. So here, hmm, okay, talk and die phenomenon. Epidural hematoma. Subdural hematoma, venous bleed, slower and less pressure, commonly seen in chronic geriatric patients. treatment is craniotomy. So it appears that uh, epidural is an urgent concern or acute concern. Subdural is more of a chronic. Mhm. Hydrocephalus, okay. Increased. I think the questions here would be regarding the shunts. Tumor, hemorrhage, infection, congenital, okay. External ventricular drain, okay. So this is it, okay. So VP shunt, ventricle, space in the brain, peritoneum, serous membrane lining the abdominal compartment, okay. Underneath the skin, entering to the cranium, valve behind the ear, okay. So from here up to the peritoneum, shunt that drains extra CSF from the brain to the abdomen. Okay, so since there is an increased central the fluids in the brain, and the shunt would decrease the pressure by releasing some of those fluids down to the peritoneum, where it can be then excreted as urine. Mm. Meningitis. What is meningitis? Inflammation of the spinal cord of the brain, okay, caused by bacteria. Dura mater, arachnoid, pia mater. Mhm. Meninges and itis means inflammation. Nuchal rigidity. I think this is nuchal is neck. Photophobia. Kernig sign. Rudzinski sign. Sleepy rash, joint pains, vomiting, headaches, light sensitivity. Okay, so there might be meningitis. I remember here, Kernig sign and Brudzinski. Hmm. Okay, Kernig signs and Brudzinski sign. Oh, there you go. Kernig sign with the patient's place of mind, the hip flexed at 90 degrees. The knee cannot be completely extended due to pain. Okay, so this is the Kernig sign. Brudzinski. So if you flex the neck, it causes an involuntary flexion of the knees and hips. Brudzinski. So it's a sign for meningitis. Mhm. Steroids. So steroids, analgesics for the pain. Antibiotics only if bacterial. So it's possible that meningitis is not bacterial. Could also be viral. Contact precautions for viral, droplet precautions for bacterial. Bacterial meningitis is very contagious. It's a medical emergency. Mhm. Maybe because of the type of bacteria. Prevention. Haemophilus influenza, HIV vaccine. What is HIV? Okay, HIV, Haemophilus influenza type B vaccine. So it means this could also cause influenza. The influenza could also cause meningitis. Recommended for college students due to living in close quarters in dorms. hmm Spinal cord injury. What's spinal cord injury? Damage to the spinal cord causes permanent changes in strength, sensation, and other body functions below the site of the injury. Symptoms depend on location of the injury. The higher the injury, the more function that's lost. Okay, so the higher from here, the more function that's lost. Injuries above T6, thoracic 6. Here, monitor for autonomic dysreflexia. Okay, and they have the definition and symptoms of autonomic dysreflexia. Irritation below the point of spinal cord injury, such as overfull bladder, sends nerve signals up to the spine. Nerve signals are blocked at the SCI, causing blood vessels to tighten and raise blood pressure. Okay. The brain sends signals to lower blood pressure, but these are blocked by the SCI. Symptoms such as sweating and severe headache result. Sudden severe hypertension. Hmm. So supposedly the brain sending signal to lower the blood pressure, but since it's being blocked, the hypertension continues, and or severe hypertension continues. What's concerning is that there's a hypertension, but there's bradycardia, headache. There's headaches, nasal stuffiness, flushing, sweating. These are consistent of hypertensions, but bradycardia is the heart. There's a slow pumping of the heart. Causes triggered by sustained stimuli at T6 or below from restrictive clothing, anxiety, pressure areas, full bladder or UTI, dehydration, fecal impaction, blisters. So T6, sit the client up to lower their BP, antihypertensive. So there will be an intervention by way of medication, hydralazine, to lower the blood pressure. Find the cause and treat. Full bladder, cath, constipated, remove impaction. So this would be symptomatic. If it's painful, remove stimuli. So whatever is the symptom, you just have to relieve the symptom. Stroke. Stroke, a disease that affects the arteries leading to and within the brain. It is the number 5 cause of death and leading cause of disability in the United States. Stroke occurs when a blood vessel that carries oxygen and nutrients to the brain is either blocked by a clot or bursts. There is a lack of oxygen to the brain, and that causes damage. Oh, that's really what stroke is all about. This lack of oxygen can be hemorrhagic, ischemic, embolic, or thrombotic. Pathophysiology, hemorrhagic stroke. A vessel ruptures and bleeds into the brain. Okay? As the blood accumulates, there's an increased pressure on the brain. The rupture can be caused by a weakened vessel, such as in aneurysm, and this is common. The worst headache of my life. Mhm. Pathophysiology, ischemic stroke. Blood flow to the brain is blocked by a clot. Thrombotic, a blood clot, an artery going to the brain. Onset in a stepwise fashion. Embolic, there's a loss of blood circulating to this area of the brain. The lack of blood leads to a lack of oxygen, causing ischemia and damage. Okay, yeah, of course. So if there's an ischemia, there's a loss of blood, and since the blood carries oxygen, so there's a lack of oxygen being transported to the brain, and that causes ischemia and damage, an irreversible condition, just like this. Oh, fast facial droop, arm drift, speech problems. Time is brain cells. This is really a medical emergency since nervous or nerve cells generally don't degenerate. And if there is an ischemia, there could be facial drooping, so even the nerves are affected, arm drift, speech problems, so the nerves are impacted, altered level of consciousness, confusion, lethargy, not acting right. Those are actually, signs or symptoms that a patient might exhibit. Aphasia, apraxia, not okay. Loss of vision, abnormal pupil response. Okay, so there's really something wrong here. Even swallowing is seen in dysphagia. Treatment. Ischemic, permissive hypertension. Ensure there's perfusion to the brain. Okay, antithrombotic. Okay, so anti-clot. Break up a clot to restore blood flow. You just have to. So if it's blocking, then you have to break up the clot. Must be done quickly. Door to TPA 60 equals 60 minutes. Percutaneous thrombectomy, surgical removal of clot done in IR. Get the bleeding under control if caused by an aneurysm, coiling, clipping done in the OR, craniotomy, EVD. What is an EVD? External ventricular drain. So ventricles not in the heart but in the brain. Enclase question. You are working in an emergency department when a client with a suspected stroke arrives. Which of the following essential nursing actions should the nurse perform? Select all that apply. So the question is asking, we have a client with suspected stroke in the ER, and the question is about the essential nursing action that the nurse can perform. Okay. Activate the stroke team, check and treat the glucose, order an immediate CT or MRI of the brain, administer TPA, administer morphine. Okay. So the way I would answer this question is what is within my scope and what would be out of my scope. I think order an immediate CT or MRI of the brain would be a doctor's. It needs to be coming from the doctor, the order. Administer morphine TPA would be within my scope. Check and treat the glucose. I would eliminate this since I think this is not. This could be for a diabetic patient, but the question is about stroke. Activate the stroke team could be yes. Okay. So I would say ADE. Let's check. You are working in an emergency. Okay. Administer morphine. Oh, the answer is ABC. Hmm. Okay. So this is one of those aha moments for me. Well, um, it has been a while, so I need to develop my test taking strategies again. This is my first day. I don't expect that I would already know, so I need to understand again. Maybe read more. According to the AHA, the immediate general assessment and stabilization should include assess the ABCs and vital signs, provide oxygen as needed, obtain an IV, check glucose and treat as needed, perform an essential neurologic screening, activation of the stroke team, order an immediate CT or MRI of the brain, and obtain an ECG. All of these actions should be included within the first 10 minutes after arrival at the emergency department. The decision of whether or not to give TPA will depend on the results of the CT scan or MRI. Okay, makes sense. If the provider determines that there is no brain hemorrhage, the team should complete the fibrinolytic checklist before deciding whether or not to give RTPA. Administering morphine is not a priority in a suspected stroke. Yeah, okay. So I think I was thinking of administering morphine since normally it's painful. There's an increased pain, and so I thought analgesics would help. Yeah, but the question was suspected stroke. I think that's the reason why it shouldn't be included. And this one is more of a, so I really need to know the nursing content of this, or because so TPA would be administered after laboratory value. Mhm. Tissue plasminogen activator. Mhm. So I didn't imagine that this would be part of a nursing within the nursing scope or nursing actions. Ordering an immediate CT. Maybe probably because it's already a standard procedure. The immediate general assessment and stabilization should include assess the ABCs, okay? So hierarchy of needs, vital signs, provide oxygen as needed, obtain an IV, check glucose and treat as needed. So even the glucose must be checked. You have to activate the stroke team. So they're saying this one is not yet necessary, and this one would be could be administered, but is dependent on laboratory value. Else, there would be the team should complete the fibrinolytic checklist before deciding whether or not to give RDPA. Okay, so I just have to accept it. Uh, yeah, this is noted. All right, so this would be my first part. I'll try to complete. Um, I have how many pages left? Mm, it's the 19 out of 28. Okay, so I'll just complete maybe it's 47 minutes. I have 10 more minutes. Um, so far, what I've learned for the neurology, I think I still have to um, read more, understand more, because just like this one, it's unfamiliar to me that there is a standard general assessment, and which includes ordering of CT or MRI of the brain, knowing the question is about nursing actions. Maybe check and treat the glucose, order an immediate CT or MRI, administer TPA. I mean, these ones are, even though I've answered them earlier, I understand why they're not supposed to. But this one, I don't understand. This one is, I would say yes, must be, and also this one. So I would have eliminated this, but obviously the answer is ABC. You just have to take it as is. hmm So a review, ischemic. Okay, so this is an emergency. Facial droop, arm, speech. Okay, aphasia. This is about the ischemic stroke. hmm And the other one is hemorrhagic stroke. Worst headache could be aneurysm. Stroke treatment. Okay, hydralazine is because even though the brain is ordering to lower the BP, but it's being blocked within the spinal cord, and so there's still a high or severe hypertension with accompanied bradycardia. Mhm. Here is spinal cord injury, autonomic dysreflexia. So even this, I think urinating would be included. For yeah, the Kernig signs and the Brudzinski sign. Okay, this one. Nuchal rigidity, photophobia, which are consistent with meningitis. And in meningitis, it's highly contagious if it's bacterial. Droplet precaution. The other one is contact precautions for viral. PP shunt, the shunt, okay. Increase hydrocephalus. Subdural would be, this one is boring a hole, the other one is craniotomy. Mhm. Skull injury, raccoon. Okay, so the cranial nerves, vagal 10. These are the increased intracranial pressure. CSF, the meninges, okay. Physiology. Mm-hmm. All right. So I think I'll I'm at number 18. If I'm not mistaken. Mm, page 20. I'll complete this later on. For now, thank you. I'll have to rest my vocal cord and drink some water. Thanks for your time.